Medical Dialogues Journal Club, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about a recent JAMA report which says that medicines take most of patients' money in India. A major proportion of expenditure for Indian patients goes into medicines, according to a study published in the Journal of American Medical Association, that is JAMA, on the high out-of-pocket spending on healthcare. The study suggested that the government should regulate the drug and diagnostic market and bring down non-medical costs like traveling to health facilities, food and lodging. Components of out-of-pocket expenditure and their relative contribution to economic burden of diseases in India report is authored by Mayana Ambade, Rakesh Sarwal and Nachiket Moore, who are all PhDs among others. They studied expenditure patterns of 43,781 inpatients and 8,914 outpatients. They concluded that 29.1% of inpatient and 60.3% of outpatients expenditure was on medicines. On the other hand, non-medical costs for inpatients were 23.6% of their spending against 14.6% of outpatients. The spending on doctor consultations and diagnostic tests went up depending on the patient's economic status. The study also noticed that annual outpatient costs were more than the annual income of households than annual inpatient costs. The study is based on the analysis of the National Sample Survey Organization in 2018. The study found that non-medical costs were significant. The share of total care out-of-pocket expenditure, that is OOPE, from doctor consultation and diagnostic test charges increased with socio-economic status, and annual cost as a proportion of annual income was lower for inpatient than outpatient services. It was noted that out-of-pocket expenditure accounted for 58.7% of national health expenditure in India. The report said that such excessive reliance on out-of-pocket expenditure creates a disproportionate burden on low-income individuals, accentuating income inequality and the medical poverty trap. It was conclusively reported that 60.3% of medical expenditure by outpatients is on medicines, 29.1% of the medical expenditure by inpatients is on medicines, 23.6% of expenditure by inpatient covers non-medical costs, that is food, lodging and traveling, 14.6% of expenditure by outpatients covers non-medical costs. That's all for today. Stay tuned to Medical Dialogue for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.